on the 24th to the 28th days. Okay? On the 24th day they start forming, on the 28th they disappear. So all arches are not seen at a time. As these arches disappear, by the time they disappear, third arch is formed completely, and fourth arch and sixth arch just start forming. So first and second start forming on the 24th day of the embryonic life. They disappear on the 28th day. By the time these two disappear, the third is completely formed, and fourth and fifth just begin to form. Okay, as this arch forms its derivative, the remaining two by that time will develop completely. Okay, will develop completely. So this is first, second. So there are 6 aortic arches which are developing into the pharyngeal arches in the mesodermal area. First one is the cranial nose. First and second appear and they disappear on the 20th to 29th day. By the time they disappear, third is completely formed. But as third is completely formed, fourth and sixth are not formed. They are just beginning to form. And as third completes its function, it is having some important derivatives. As they are formed, fourth and sixth will be completely formed. This third disappears, gives rise to some structures. By the time it completely disappears, these two are formed, fourth and sixth. Fifth appears as a rudimentary bud and it disappears. It is not having any derivatives. Now coming to the first arch, this first arch develops and it forms maxillary artery. Maxillary artery. So, maxillary artery is derived from the first aortic arch. So, what is derived? The answer is maxillary artery. First aortic arch. Now, second aortic arch, it disappears on 28th or 29th day of the intrauterine life and gives rise to hyoid artery and stapedial artery. Stapedial artery. This stapedial artery is related here. You will see these arteries afterwards when you will learn about the head neck face. Then coming to third arch, these two also disappear, but very small portion remains that gives rise to these two arteries. Now from third, fourth, and sixth, these will form very important arteries supplying to the head neck face as well as to the neck and thoracic region. So these three arches are very important. Coming to the third aortic arch. Now third aortic arch gives rise to one important artery which runs cranially like this. This artery is an external carotid artery. This one is external carotid artery. Okay, this two. Okay, external carotid artery. It is formed by angiogenesis, vasculogenesis. We know it is formed in that region only. It is not coming from these arches. It is a new artery formed in this area. That is external carotid artery. Now, this third aortic arch is divided into two parts. This is a ventral part because it is in the ventral plane, ventral aspect, and this one is a dorsal part. This ventral part forms the common carotid artery. This forms a common carotid artery on both the sides. From what? From the origin of the aortic sac origin to the budding of the external carotid artery. Only this portion will form a common carotid artery on the right and left side. The new artery formed is the external carotid artery, as we have seen. This one is a external carotid artery. Okay. Now coming to the next part, which is remaining part of the third aortic arch. Now this part, along with the dorsal aorta cranial to this part, this will form internal carotid artery. This will form internal carotid artery. This part and cranial to this. So this is going to form an internal carotid artery. So what we have seen here, third aortic arch artery. There is one new artery formed here, which divides the third aortic arch artery into ventral segment and dorsal segment. The ventral segment on both the sides forms common carotid artery. The new artery which is formed here, it joins here. This artery is the external carotid artery and dorsal part of the third aortic arch along with the dorsal aorta on both the sides will form an internal carotid artery. So I will label this internal carotid artery. Okay. Now coming to the fourth aortic arch. Fourth aortic arch is very important. On left side, it forms the arch of aorta. On the left side, it forms the arch of aorta. The third is going to form a common carotid artery, internal carotid artery, as well as external carotid as a new part. New artery forms this area. Okay. So this third will form common as well as part of internal. Now coming to fourth on the left side will form arch of aorta. Arch of aorta. It will take part in the formation of the arch of aorta on the left side only. At this level, at the level of the fourth aortic arch, one new vessel comes and joins here, and that is seventh cervical intersegmental artery. Intersegmental artery. Okay, this is on the left side as well as right side. On both the sides, this artery joins the dorsal aorta. This is seventh cervical intersegmental artery. Okay. It joins at the level of the junction of the fourth aortic arch with the dorsal aorta. So on the left side, this is the arch of aorta. Now this artery will form a subclavian artery. On the left side, subclavian artery. Okay. So this is the left subclavian artery. On the right side, what happens? This part forms the left subclavian artery along with this seventh intersegmental artery. So on the right side, subclavian artery is having more length than on the left side. Remember this, because this part is forming arch of aorta, and whatever new artery coming here, seventh cervical intersegmental artery, that is going to form a subclavian artery. But on the right side, this part as well as this seventh cervical intersegmental artery is going to form right subclavian artery. Is it clear? So this whole structure now is going to form a subclavian artery. Now coming to next, fifth one appears and immediately disappears. So no derivative from the fifth aortic arch. Now coming to the sixth one. This sixth arch bilaterally gives one heart which supplies the developing lungs. It supplies developing lungs are developing by this time. So the new artery emerges from the sixth aortic arch artery and it divides this into ventral and dorsal part. On both the sides, these parts are there, lung parts are there, which are supplied by this artery. So this is the artery to the lung part. Okay, new lung part which is formed. So it is divided into two parts, ventral part and dorsal part. Now, this ventral part on both the sides forms right and left pulmonary artery. So this is the right pulmonary artery and this one is the left pulmonary artery. Right pulmonary artery and left pulmonary artery. Okay. So this is the sixth aortic arch. Right and left pulmonary arteries are formed from the ventral part of the sixth aortic artery. Now coming to this dorsal part. Dorsal part, on the right side it disappears. On the right side it disappears. Okay. On the left side, or you can leave it like this. Okay. It disappears, and on the left side it remains in the fetal line and forms the ductus arteriosus. Ductus arteriosus, which is very important structure in the fetal line because through this only many tissues, many developing parts are getting blood through this ductus arteriosus. Okay. So this is the pulmonary trunk, right and left branch pulmonary artery. Pulmonary trunk is formed in the truncus arteriosus only, which is below this. So pulmonary trunk is formed here. This is the aortic sac, which is having a dorsal compartment and ventral compartment. In the dorsal compartment, open these 6 aortic arcs. Pulmonary trunk is formed here. Then there is a dorsal compartment to which pulmonary trunk is in communication. This dorsal compartment is in continuation with 6 aortic arteries. Is it clear? So pulmonary trunk, then you get division of the two, and all these structures, division of this pulmonary artery lies more on the posterior plane. If you see the adult structure of the arch of aorta is like this. First, pulmonary trunk is placed more on the ventral aspect. Okay, then it goes to the left of aorta, then it goes posterior to the aorta, and then divides into two. Okay. So here it is anterior, but at the cranial end it is posterior, isn't it? So the same is here. In the truncus arteriosus, it is anteriorly placed, then it goes posteriorly. It communicates with the dorsal compartment of aortic sac, into which these two pulmonary arteries are opening. So pulmonary trunk divides into two, that is right and left pulmonary arteries. Okay. Now remaining part of the aortic sac, which is ventral, along with the left horn, along with this left horn, will form aorta, arch of aorta. This will form arch of aorta, aortic sac, left horn of the aortic sac, this portion, along with this fourth aortic artery. These are the 3 components which form the arch of aorta. Ascending aorta is formed in the truncus arteriosus. Now this is the arch of aorta from aortic sac, left horn, and fourth aortic artery. These 3 components will form an arch of aorta. Okay. So we have seen that here this portion disappears, but here there is a development of the ductus arteriosus, which afterward forms ligamentum arteriosum. Ligamentum arteriosus. What are the changes? Afterward, what happens to ductus arteriosus, and then it changes to ligament or fibrous structure. In the ductus arteriosus is very important in the fetal life because it carries blood to the abdomen, lower extremity, and other parts. But after birth, it is not needed, so it is fibrous. What happens to this? New tissue develops in the ductus arteriosus, and it blocks the lumen of the ductus arteriosus. And in 3 to 4 days, there is a fibrosis, so there is a constriction of the ductus arteriosus, which leads to a fibrous ligament, which is known as ligamentum arteriosum. Okay. So now we will see some important vessels and how they are formed. Okay. First, we have seen arch of aorta. Arch of aorta. How it is formed? It is formed. First structure responsible is aortic sac. Aortic sac. Then left horn of aortic sac. Okay. Then fourth aortic arch artery. Fourth aortic arch artery. All these combined together and form an arch of aorta. Now, how ascending aorta is formed? Ascending aorta is formed by the two compartments which are formed in the truncus arteriosus. So there is a spiral septum which divides the truncus arteriosus into two. So it is coming from the truncus arteriosus. It is coming from the truncus arteriosus. Now coming to the descending aorta. How descending aorta is formed? Now we have seen here that there is an aortic sac which divides into left horn and right horn. Left horn is going to form arch of aorta. Right horn forms the brachiocephalic trunk. Brachiocephalic trunk, which ultimately divides into right common carotid and right subclavian artery. So this right horn forms a brachiocephalic trunk. Okay. So you should know right here brachiocephalic trunk, which is coming from the right horn of the aortic sac. Right horn of the aortic sac. So these are the major vessels which are derived here from this. Now we will see how the nerves are related here. Okay. Various nerves related here are the cranial nerves which supply these aortic arches or pharyngeal arches. Each pharyngeal arch is supplied by one specific nerve. Okay. So this is a dorsal aorta. Now we have seen that descending aorta is formed. Here is the fourth intersegmental artery, cervical intersegmental artery. Remaining whole this part and from junction downwards, this part disappears. This part disappears on the right side from the seventh cervical intersegmental artery. From seventh onward, this part disappears. Okay. So descending aorta is formed from the dorsal aorta, according to the junction of the left seventh cervical intersegmental artery. Then it joins here with the right sided structure, but right sided structure disappears and then descends downwards up to L4. So this is forming a descending aorta. In its some part is in the thoracic region, thoracic descending aorta, and some part is in the abdominal region. It is known as abdominal descending aorta. Now coming to the various nerves here. Nerves are related to this. So for that purpose, I will have to remove this part. Now one more feature about this is first, second and third aortic arch. The dorsal aorta between third and fourth is not used, and so it disappears on both the sides. Okay, this part disappears. Why it disappears? Because it is not used. How it is not used? Because whatever blood is here, either it comes through the arch of aorta, then descending aorta, and then supplied to the various organs, or it will go to the common carotid artery, and through external and internal carotid artery it will go to the head and neck. So this portion is not at all used. This is called as ductus caroticus. This is called as ductus caroticus. Afterwards it forms ligamentous caroticus. So ligament is formed there. This part disappears. Okay. Now coming to the nerves, how they are related to the various arches. Now first arch is supplied by the fifth cranial nerve. Okay. First arch. Then second arch is supplied by the seventh cranial nerve, which is a facial nerve. Okay. Third arch here is supplied by the ninth cranial nerve, which is a glossopharyngeal nerve. All these nerves lie lateral to the artery, corresponding artery. So whatever nerve is there, it will go like this. This will go like this. So it is lying laterally, and then it will supply whatever structures are derived from that particular pharyngeal arch. Okay. There will be muscles also, nerves also. Various structures will form from the pharyngeal arches. We are taking only one component, that is aortic, means artery component of that pharyngeal arch. Now this one is the fourth one. Then fifth disappears, and here is the sixth one. Now fifth and sixth are supplied by the branches from the inferior ganglion of the vagus. Of the vagus nerve. Vagus is a 10th cranial nerve. Okay? It is a 10th cranial nerve. From here, the branches go to the fourth as well as sixth aortic arches, pharyngeal arches. Okay. Now, how these nerves are going? They will go here and then move upward. This is known as superior laryngeal nerve. As it is a laryngeal nerve, it should go to the larynx and supply the muscles of the larynx or whatever structures are there. Then there is one more nerve coming from vagus, that is recurrent laryngeal nerve, which will go like this. It will again go upwards like this, towards the larynx. So this is a recurrent laryngeal nerve. Recurrent laryngeal nerve. Both will ascend upwards and they will go to the larynx. As they go to the larynx, they lie in the tracheo-esophageal groove. There is a groove in the neck, tracheo-esophageal groove. Trachea is ventrally placed, esophagus is behind that. And they go in between these two structures. And recurrent laryngeal nerve is very important. It supplies all muscles of the larynx except one muscle of the larynx, that is cricothyroid. All muscles, in all muscles also, the posterior cricoarytenoid is very important because it is the only abductor of the vocal cords. It is the only abductor of vocal cords. So if vocal cords are not abducted, air entry will not be there. So this is a very important muscle which is supplied by the recurrent laryngeal nerve. This muscle is known as life-saving muscle. So this is the importance of the recurrent laryngeal nerve. Now what happens on the right side? On the right side also you get a vagus ganglion, inferior vagal ganglion, which will give superior laryngeal nerve, and the recurrent laryngeal nerve will go like this. Okay? This will go up. This one is a recurrent laryngeal nerve. On the left side, what happens? This is a continuous part. Patent ductus arteriosus is there. So this will remain in this position. At the most, as ductus arteriosus comes in contact with the arch of aorta, it will slightly move upward and it will hook around the arch of aorta. Okay? And arch of aorta is in the thoracic region. It is related to the superior aspect of the arch. So it is in the thoracic region. But on right side, what happens? This recurrent laryngeal nerve hooks around the sixth aortic arch because it is a it supplies all the structures of the sixth aortic arch. But this portion disappears. So this nerve ascends upwards. Here there is no ascent, but here it ascends upwards. And fifth also disappears. So it comes here. It comes here, and this is the subclavian artery, third aortic arch. Okay? That is a subclavian artery. It comes to the subclavian artery. On the right side, fourth aortic arch forms a subclavian artery. So it ascends upwards and comes to the subclavian artery, which is in the neck region. During development, this heart, along with this lower portion, descends down in the thorax, and this third arch or fourth arch on the right side also remains in the neck region. So on the right side, the right recurrent laryngeal nerve is at a higher level and lies in the neck region. But on the left side, it hooks around the arch of aorta, which is near the ductus arteriosus and remains in the thorax. So this is the very important part of this aortic arch. Now coming to the clinical aspect.
Left part
no, it will not ascend because it will be obstructed by the arch of aorta and ductus arteriosus, which is going to form a ligament, isn't it? I'll draw only that part. Now see, this is the aortic arch. This one is the arch of aorta. Okay, here on the right side, this forms a subclavian artery, isn't it? And here it is a arch of aorta. Then here is the sixth arch artery. This is ductus arteriosus part, and this is the pulmonary trunk, isn't it? Pulmonary artery. Okay. On the right side also, this is the pulmonary artery. Okay. And this portion disappears. This portion disappears. On the left side, the portion which forms ductus arteriosus, on the right side it disappears. So the laryngeal nerve, recurrent laryngeal nerve, will ascend upwards from this position. Okay, first it was like this, but it will ascend like this. And subclavian artery remains in the neck. It will not descend down because it has to go to the upper extremity. So it will remain in the neck region. But here what happens? Whatever nerve is coming, it will go in this fashion and it will not move much upwards because this is a arch of aorta which is coming down along with the heart. Okay? So on the left side, recurrent laryngeal nerve descends downward in the thorax, but here it doesn't descend in the thorax, it lies in the neck. Both are having the recurrent part. They come down from the dorsal, from the inferior ganglion and then go up. So this is a recurrent part. So this is known as recurrent laryngeal nerve. Okay? So this is a recurrent course. They come down and again go up towards the larynx. So coming to the anomalies related to the development of all these structures. Okay. The first anomaly which is seen is brachiocephalic trunk joins with left common carotid artery. Now, how is the structure here? See, this is the arch of aorta. This is the left subclavian artery as usual. Okay. Then there is a common trunk. Here is the brachiocephalic trunk. And here you get left common carotid artery. This is the second most common model of artery seen in the human being. The first one is whatever we study. Normal is like this. Three arteries originating from the arch of aorta. This left subclavian artery, left common carotid artery, and this is brachiocephalic, which divides into two. This is right common carotid, and this is right subclavian artery. This is very common, but next to that is this pattern, which is common in the human beings. Now, next is the aberrant right subclavian artery. Aberrant right subclavian artery. Aberrant means abnormal. Abnormal origin of the right subclavian artery. Suppose this is the arch of aorta. Here is brachiocephalic trunk. Here is the right, left common carotid artery. This is left subclavian artery. And this one is right subclavian artery, which from this point goes to the right side in this fashion. So this one is the right subclavian artery, which is taking origin from the distal end of the arch of aorta. So four arteries originating separately from the arch of aorta. Left subclavian should come from this brachiocephalic trunk, but instead of brachiocephalic trunk, there is right common carotid artery. Okay, so this is the picture. What will go wrong with this pattern of the vessels? There is a loop formation. Now, arch of aorta is ventrally placed, but this is dorsally placed, and this one is on the ventral aspect. So while moving, while curving, it goes backwards, and in between these two loops, there is a trachea divided into two like this. Okay. Along with that, behind trachea, there is a esophagus. There is a esophagus also behind this. So this is the trachea. And this is the esophagus. So what will happen to these two structures? If there is a big artery in front and one more artery, big artery behind, these two will be in between these two big arteries which are forming a loop-like structure. They will compress on this. They will compress on these structures. So esophagus will be constricted, and that will give rise to dysphagia. That will give rise to dysphagia. Dysphagia means difficulty in swallowing, difficulty in deglutition. Second, if trachea is also compressed, there will be a stridor. Stridor means what? It is, yes, constriction of trachea takes place, because of which there is a difficulty in breathing, which gives rise to a voice that is known as stridor. It is a harsh vibrating sound. It is harsh vibrating sound which is easily identified. So these are two important symptoms seen here. Along with that, if this becomes chronic for a longer duration, these two are compressed, then what happens? The wall between these two will degenerate and they will communicate with each other. As these two are compressed, their walls will degenerate and they will communicate with each other. So these are the various signs and symptoms and findings seen when the right subclavian artery is having an aberrant origin. Then next you get patent ductus arteriosus. Now what is the function of ductus arteriosus? There is an arch of aorta like this, okay, which are having three vessels here. Big vessels are this, and then pulmonary trunk is coming like this, and it is dividing into two. Okay. Here. Now one small this is a ductus arteriosus which connects the left pulmonary artery to the arch of aorta. To the arch of aorta. Now, this should be patent, and it is patent in the fetal life, so that blood from the pulmonary trunk will move here and come down, and it will supply abdominal organs and lower limbs. Okay, in the fetal life, these organs are very small, just developing, so whatever blood is received here, oxygen content is less in this blood because these are coming from the pulmonary trunk. Okay, so this low oxygen content is also okay for these developing organs. But as the age advances and after birth, also this deoxygenated blood will not provide proper nutrition, sufficient nutrition to the important abdominal organs as well as lower limb. Then what happens to these organs? The kidneys will be affected, which are very important structures. Liver will be affected. Along with that, intestine also needs more oxygen. These organs are affected. Along with this, lower limbs will become grayish if they are supplied with the deoxygenated blood. So, patent ductus arteriosus calls all these things which are not compatible with the life. Kidney, liver, intestine, as well as lower limbs will not survive, and you have to give a treatment for this. So this is a patent ductus arteriosus. Now coming to the next one, that is defect in the truncus arteriosus. What is the defect? Spiral septum, which is formed in the truncus arteriosus, may not be complete. If this is a truncus arteriosus, spiral septum should divide this into two compartments. Then only two separate arteries will be formed, aorta and pulmonary trunk. But if septum is not formed in this area, these two vessels are in communication. So deoxygenated and oxygenated blood will mix with each other, and that blood will be supplied to the children. So spiral septum should be completely formed, and it should form aorta and pulmonary trunk. This is ascending aorta and pulmonary trunk, which are formed because of the spiral septum. Then fifth one you get is the we have seen transposition. In the next session, in the previous session, we have seen transposition of the great vessels. Okay. Then sixth one is the right-sided aorta. Right-sided aorta. Then there is a rotation of aorta. Then there is a double aorta. Double aorta. There may be cervical aorta. Cervical aorta. So we will see one by one. Right-sided aorta. Now usually it is left-sided. If it becomes right-sided, so here will be the ascending aorta. Then this is the arch of aorta. Okay. So it is coming from right to left. What will be the effect? Suppose here is a trachea. This is the left bronchus, which will be here, and here will be the right bronchus. So left bronchus will be compressed by the arch of aorta because it is coming like this. Then here will be the right subclavian artery. Here will be the right common carotid artery, and here will be the brachiocephalic trunk, which will divide into left common carotid artery and left subclavian artery. So this will be the pattern. It will go to the right side, from left to right side. So the arrangement of arteries will be different now. Brachiocephalic trunk, which normally is on the right side, will go to the left side. So there will be compression of the right bronchus now. Previously it was on the left bronchus. So this is the right-sided arch of aorta. If the aorta is formed on the right as well as left side, the diagram is like this now. And from this you get a descending aorta. Here is the right aorta, and here is the left part of the aorta. Okay, two arches are formed on both the sides. this part actually disappears, but here it is present and forms a right-sided aorta. Here you get right subclavian, here you get left subclavian, here is brachiosacral, here also you get brachiosacral, which divides into units like this. Okay? So this is the one pattern you may get if right-sided dorsal aorta doesn't disappear. So we have finished right-sided. Coming to the coarctation of the aorta, we have seen the patent ductus arteriosus, and there is a fibrosis of the ductus arteriosus after birth. Now this is the pulmonary trunk, and here is the ductus arteriosus. It gets fibrosed after birth. Okay? So this fibrosis process, which first involves formation of the new tissue. Now this formation of the new tissue may extend here or here in the aorta. It may extend in the aorta also, formation of the new tissue. Now there will be a constriction of this, which will lead to the fibrous tissue here. In the same manner, there will be a constriction here, or it may be here, or it may be here. So this is one constriction which is known as pre-ductal coarctation. This is known as pre-ductal coarctation, and this one is known as post-ductal coarctation. Okay? Pre-ductal coarctation is pre-ductal stenosis, and this is post-ductal stenosis. This is the extension of the whatever process is going on in the ductus arteriosus that extends into the aorta. If it extends into the proximal part, it leads to the pre-ductal coarctation, and if it goes to the distal part, then it leads to the post-ductal coarctation. Now, what are the effects of this? Now, subclavian artery is coming from this. Is that it? This is the subclavian artery. This subclavian artery supplies left upper limb. Is that it? It supplies left upper limb. Now, if coarctation is here, the ductus arteriosus, which is bringing impure blood, it was bringing impure blood. Now, here is a constriction. So, this portion, along with this portion, will not get much oxygenated blood because here is a stenosis. Is that it? Aorta is bringing blood in this direction, but as there is a stenosis, left subclavian artery as well as descending aorta will not get much amount of blood. So, upper limb will be not supplied with the proper oxygen and nutrition, along with this descending aorta, which is going to supply abdominal parts and lower limbs. So, oxygen content will be less. If you see the oxygen in the blood by oximeter or some other instrument, you will see that oxygen content of the blood is less here, and in the head neck face it is more. Not only this, blood pressure above will be more and below will be less. Now, if the constriction is here, which is post-ductal, what will happen? The subclavian is proximal to this constriction, so this will get oxygenated blood. So, upper limb will receive oxygenated blood, it will develop well, but lower down in the lower limb, the blood pressure will be less. So, post-ductal will lead to the, in lower limb, blood pressure is reduced. Along with this, pulse is also very weak as compared to the upper limb. Upper limb blood pressure is normal as well as pulse is strong, but it is not seen in the lower limb. So these are the findings when there is a coarctation of the aorta. We have seen coarctation of the aorta, double aortic arch, then cervical aorta. What is this cervical aorta? Aorta usually develops from the fourth aortic arch, isn't it? Fourth aortic arch. Here will be the development of the aorta. But sometimes fourth arch disappears, and from third arch you get arch of aorta. From third you get arch of aorta, which is third aortic arch. Okay. From this you get arch of aorta. Now third aortic arch is in the neck region. Fourth descends, but third is in the neck region. So what will happen? Arch of aorta will be in the neck, and it will be seen as a pulsatile mass in the neck region. Okay. So these are the symptoms seen here. So what we have covered today? The formation of the great vessels. First is the arch of aorta, which develops from the aortic sac, left third and left fourth aortic arch artery. Okay, on the right side, fourth aortic arch artery forms the proximal part of the right subclavian artery. Okay, coming to the sixth. What sixth is giving rise to? Pulmonary arteries. Right and left pulmonary arteries from the ventral part. Dorsal part on the left side forms the ductus arteriosus. On the right side, it disappears. Okay. First forms maxillary artery. Second forms hyoid artery and trapezial, hyoid artery and stapedial artery. Third forms common carotid and internal carotid. External carotid comes out as a new bud. Okay, so these are the important structures. Now coming to brachiocephalic. Brachiocephalic is formed from the right horn of the aortic sac. So this you have to remember, mainly the development of the aortic arch. Okay, so here we can stop. Thank you.